This is me talking live, and what I'm gonna press play, and you're gonna see some white controllers and glasses representing what's going on right now, and then I'll show you the assessment at the end. This is Dr. Matthew Bramlett, and what we have here are two examples of vascular rings. So you can see here's a double aortic arch, and here we have a right aortic arch with an aberrant left subclavian. And the value that we have in VR is trying to understand this very complex totem-potent arch, which is so confusing. But essentially, what we can do here is we can show how we can see that aberrant left subclavian and how that ligament ties it to the pulmonary artery, which when you consider that ligament coming off of here, it creates that sort of diverticulum of Kummeral, which is hard to see. This is a very, very, very small preemie when we scan this one. Over here, the image in reference here for this double aortic arch doesn't take into consideration if this is very patent, because that's what was in the textbook. But essentially, in this scenario, it is a persistent of that arch. And to kind of show, I can kind of pull it in like this, so you can see how those vessels come off and relate to that chart. And then stick around to see the assessment. So that was this, and these are pictures I just took on my iPhone. These were some models that we already had. I can change the size of them. As you can see on this model here, we can adjust the transparency of the different components so that, like, here's the skin. So this is how I knew that this patient was actually very young. Is the size of the different leads. I mean, you can see how that lead was just ginormous. But what I want to show you next is the assessment. So please close your eyes if this is a little dizzying. Click on this. Which segment persisted to create this pathology? The student then has an opportunity to identify this is a double aortic arch. The right section is the section that persisted, which is right here. Interestingly, because it's the larger section, the surgeon will ligate here. But this is the answer according to that question. Like if I click this would be the wrong answer. But by selecting and highlighting that, I can then go over here and submit my answer and got it right. So that's how this works. Thank you.